U.S. experts are expected to recommend COVID-19 vaccine boosters for all Americans, regardless of age, 8 months after they received their second dose of the shot, to ensure lasting protection against the coronavirus as the Delta variant spreads across the country. Federal health officials have been actively looking at whether extra shots for the vaccinated would be needed as early as this fall, reviewing case numbers in the U.S. as well as the situation in other countries such as Israel, where preliminary studies suggest the vaccine's protection against serious illness dropped among those vaccinated in January. An announcement on the U booster recommendation was expected as soon as this week, according to two people familiar with the matter who spoke to the Associated Press on the condition of anonymity to discuss internal deliberations. Doses would begin to be administered widely only when the Food and Drug Administration formally approves the vaccines. That action is expected for the Pfizer shot in the coming weeks. Last week, U.S. health officials recommended boosters for some with weakened immune systems, citing their higher risk of catching the virus and evidence that the vaccine's effectiveness waned over time. The director of the National Institutes of Health, Dr. Francis Collins, said Sunday that the U.S. could decide in the next couple of weeks whether to offer coronavirus booster shots to Americans this fall. Among the first to receive them could be healthcare workers, nursing home residents and other older Americans, who were some of the first Americans to be vaccinated once the shots received emergency use authorization last December. Since then, more than 198 million Americans have received at least one dose of a COVID-19 vaccine, according to the Centers for Disease Control and Prevention, with more than 168 million fully vaccinated. Still, the country is experiencing a fourth surge of virus cases due to the more transmissible Delta variant, which is spreading aggressively through unvaccinated communities but is also responsible for an increasing number of breakthrough infections of fully vaccinated people. Israel, which exclusively administered the Pfizer shot, has been offering a coronavirus booster to people over 60 who were already vaccinated more than 5 months ago in an effort to control its own surge in cases from the Delta variant. For months, officials had said data still indicated that people remain highly protected from COVID-19, including the Delta variant, after receiving the 2-dose Pfizer or Moderna regimen or the 1-shot Johnson & Johnson vaccine. But U.S. health officials made clear Sunday that they are preparing for the possibility that the time for boosters may come sooner rather than later. There is a concern that the vaccine may start to wane in its effectiveness, Collins said. And Delta is a nasty one for us to try to deal with.